Did you know 40 people were selected by the American Society of Clinical Pathology for their achievements in the field? 40 people all across the country. Now they're being recognized for those achievements. And this morning, one of those doctors, Dr. Ramagulapalli, is a physician and scientist at UNM. He is one of the 40 under 40. We're lucky to have him in Albuquerque, and he's here on the show this morning. Good morning, doctor. It's good to see you.
Good morning, Matt. Thank you for having me.
It is our pleasure. First of all, congratulations.
Thank you very much.
So what does this award mean to you? 40 under 40 of folks who work in, not folks, but doctors who work in clinical pathology all across the country. That's a lot of doctors.
That's correct. So the American Society of Clinical Pathology is a premier professional organization representing pathologists. And this year they chose 40 individuals under the age of 40 to represent the qualities that are important for the growth of the organization and the future of pathology in general. And that's what it is about.
Okay, so let's talk pathology. For folks who don't know, what is it?
So I have a analogy that I give often. So when you consider a football analogy, when you consider medical profession as a whole, the surgeons are like your quarterbacks, whereas your physicians are more like your defense and linebackers.
Okay.
We pathologists are like the referees in a football game. So we are the guys who tell whether the ball is in or out, if it's a cancer or not. You know, we are the guys who are dealing with the laboratory end of things and making sure all the test results are right and so forth.
So when we go to the doctor, we get blood samples or some other samples taken. It's doctors who are pathologists like yourself. You look at all that to see what exactly is wrong with us.
That's absolutely right, Matt.
Okay.
I mean, most of the times, especially in cancer, there is a huge deal about whether a tissue is benign or malignant. That's an important consideration. And we are the physicians who are dealing with that aspect of it, making sure that the tissue is either benign or malignant and give a diagnosis and so forth.
And by giving those diagnoses, particularly early, you're able to help save people's lives.
Absolutely, absolutely. It's the pathologist report from which everything comes out afterwards. In fact, the College of American Pathologists put out a study that says 70% of a diagnosis or a treatment is all dependent on the laboratory results that come for a patient. So that's a pretty significant chunk, I think.
It is. So do you feel a lot of pressure then when you're in the lab and you're at work and you're looking at samples?
Absolutely. I mean, it's a privilege and a real important thing going on in your mind when you have to make that decision about whether a tissue is benign or malignant and so forth. So it is a lot of pressure, but it's a job that I think we really enjoy, and that's why we are pathologists. It means a lot to us.
And what's it mean to you to be selected as one of the 40 under 40, basically one of the, this is your first job at UNM, here's your first
Correct.
job out of your residency and your fellowship.
Right.
So you're one of the major up-and-coming doctors in the whole country in this field.
That's one way of looking at it. It's a great honor to have received this award, and I'm very pleased to have been recognized at the national level.
All right, we are lucky to have you in Albuquerque at the UNM Cancer Center. If you want to find out more about Dr. Ramagulapalli and what he does and the Cancer Center, you can head to our website at casa.com. I must say, he grew up where I went to school in Gainesville, Florida.
Yes.
The guy's a Gator. He's a good guy. Doctor, congratulations on the award. Thank you for your work. Thanks for being here in Duke City. It means a lot to us.
Thank you very much, Matt.